Ear drops are similar to eye drops in that you can also assist with hand-over-hand technique. Have the resident tilt their head to the opposite side so that the affected ear is up. Pull the earlobe up and back in order to straighten the ear canal. Using hand-over-hand technique, assist the resident to place the eardrops. Avoid having the dispenser touch the ears. When complete, place the bottle back into the original box. Try your best to have the resident stay in the same position for a few minutes, or put a piece of a cotton ball in the ear to avoid the medication from leaking out. At the completion, wash your hands and document. When assisting with nasal sprays, you can do hand-over-hand technique as well. It is important to remind the resident not to put the tip of the spray more than 1/4 of an inch into the nasal passage, and to remind them that they must squeeze or press the spray themselves. Have a clean tissue ready so that they can wipe any excess drainage if needed. For residents who have prescribed patches, such as a nicotine patch, wash your hands first. You can open the outer package and start to remove the protective covering if the resident cannot do so. Label the patch before putting it on the resident's body. Ask the resident where their other patch is and have them remove it before putting the new one on. Place the new patch in the resident's hand and ask where they plan on putting it. Assist the resident with your hand behind theirs in placing the patch. Wash your hands and document. For residents who have a prescribed topical medication such as Gold Bond medicated, vitamin A and D, or lidocaine gel, we can only assist with hand-over-hand technique. You may not squeeze the medication into your own hand and apply it like a regular moisturizer. The resident is the only person that can have the medicated ointment or lotion in their hand. After assisting with hand-over-hand technique, wash your hands and document. Just as a reminder, regular moisturizers do not require hand-over-hand technique, and you can assist directly with that. If assisting with insulin, there are a couple of things to determine first. Does the resident have pre-filled syringes in the fridge, or do they have an insulin pen? In either case, you would pass the resident the bag with the correct insulin in it. So the bag should be labeled with AM if it needs to be given in the morning. You can take out the appropriate syringe if they are pre-filled, and any other supplies the resident may need, such as an alcohol wipe, and make sure that the resident has their sharps container near to them. At this point, your role is only to observe and perhaps verbally cue for safety. Do not ever open the sharps container. Do not put on a needle to the insulin pen. Do not remove the cap from the insulin syringe. If the resident cannot do these tasks, let the program nurse know, and perhaps they will need a visiting nurse referral. Once the resident has safely administered their insulin, your role is simply to cue them to put their sharps, whether it's the actual needle syringe or the top of the needle pen, into their sharps container by themselves. Do not ever take back a needle. Do not recap a needle for the resident. Do not hold the sharps container for them. Your safety is very important, so you should not put yourself at risk for a potential needle stick by doing those tasks. When assisting with inhalers, Inhalers will be written in the order they are to be given, with specific instructions if needed on the SAMM assignment. Make sure all parts of the inhaler are firmly in place and that the mouthpiece is removed if applicable. Remember that inhalers come in all shapes and sizes now, so please do not hesitate to ask your colleague or the program nurse for help in using one that looks unfamiliar to you. At the time of the medication reminder for inhalers, remind the resident to do these tasks. Have them take a deep breath in and then exhale completely. When about to take their next deep breath in, they should remember to inhale deeply and slowly through their mouth while pushing the top of the canister with their index finger. They should then hold their breath for 10 seconds or as long as they can, then slowly exhale. They should wait 1 minute between puffs of the same inhaler. Inhalers with mouthpieces should be rinsed, dried, and then returned to the box. If the resident has more than one kind of inhaler, they must wait 5 minutes between each type of inhaler. Follow any specific instructions on the SAMM assignment that may go along with an inhaler. For example, some inhalers require the resident to rinse their mouth afterwards. Remember, if the inhaler is down to 6 puffs left, please let the program nurse know that it needs to be reordered from the pharmacy. At the completion, wash your hands and document. A nebulizer is a device which changes liquid medication into fine droplets that are then inhaled through a mouthpiece or a mask. The air compressor needs to be on a sturdy surface that supports its weight and will not overheat it, such as a side table. It needs to be plugged into its own outlet as well. After washing your hands, remove the top of the nebulizer cup by twisting it counterclockwise. The resident must then twist off the top of the medication vial and squeeze the medication into the nebulizer cup. You can do hand over hand. However, you cannot do this task on your own. The resident must be actually opening and squeezing the medication. Reattach the top of the nebulizer cup by twisting it clockwise. Then connect the mouthpiece or mask to the cup. Make sure all tubing is connected to the compressor and to the nebulizer cup. Turn the compressor on via its switch. When the compressor is on, you will start to see a light mist coming from the tubing. Have the resident sit straight in a comfortable chair. Have them put the mouthpiece in between their teeth and seal their lips around it. If they are using a face mask, be sure the mask is comfortable and secure on their face. Have the resident take slow, deep breaths through their mouths. If possible, they should hold their breath for 2 to 3 seconds before breathing out. The treatment should take about 10 to 15 minutes, and you should stay with the resident until the completion of this treatment. If the resident becomes dizzy or short of breath, turn the compressor off and have them rest for 5 minutes and contact the program nurse. If the resident is able and willing, have them try to complete the treatment, but to breathe more slowly. If they are unable to finish, report this to the program nurse. After the treatment, it is normal for the resident to begin to cough. Encourage them to take deep breaths and to cough if needed to clear any secretions which have now been loosened in their lungs. The nebulizer tubing, cup, mask, or mouthpiece should be washed daily in warm, soapy water with a mild soap or detergent. It should be then rinsed with water and allowed to air dry. Tubing should be newly delivered every 30 days and changed at that time. For a PRN, or as-needed medication, the resident must initiate the request. If the resident says, "Can I have something for pain?" you can let them know that they have Tylenol for pain, but you will need to check to make sure it is safe to give it to them at that time. It is critical that you check the PRN SAMM documentation book before giving the PRN medication. All PRN medications have what is called a parameter. This means the medication can only be given within a certain time, or there may be a risk of harmful adverse effects on the resident. After giving the PRN medication, you must document when and why you gave the medication in the PRN book. Only document on the lines provided and let the program nurse know when you need an additional PRN sheet. The policy for the management of narcotics is as follows. Any narcotic prescribed for a resident by a physician will be stored in a locked container in the resident's apartment. A count will be done at the time of delivery and weekly. The weekly count will be done by a nurse and a personal care homemaker, and will be documented on the medication sheet that is located inside the resident's locked box in their room. For narcotic medications, a count needs to be done at the time of delivery with a personal care homemaker and the delivery driver, or 2 personal care homemakers. You cannot do the count alone. If needed, you can ask any other staff member to do the narcotic count if there is no other personal care homemaker and if the driver is unable to do so. The medication must then be stored inside of a locked box. Independent documentation for a narcotic needs to be kept inside of the locked box with the medication cards. Report to the program nurse or the on-call immediately if there is a discrepancy to the count. For narcotics, every week, the program nurse and the personal care homemaker will complete a count of the narcotics in the resident's room and sign on the documentation sheet together. Again, please report when new sheets are needed and only sign on the lines provided. Controlled substances, which include narcotics, are designated by a large red C, which is printed on the medication on time card. All cards need to be reviewed by a nurse at the end of the monthly cycle. Controlled substances that are not narcotics will have documentation in the SAMM book as usual. Narcotics that are discontinued will be counted, documented, and destroyed by a nurse in the drug buster solution with a witness to verify that all narcotics have been destroyed. As a reminder, please be sure you are completing the entire SAMM assignment, which can include many things. Please be sure to let the program nurse know when a PRN medication or loose medication is running low. A loose medication are things like eye drops, inhalers, liquids, and patches.